Well, hi, everybody. Welcome and good afternoon. I'm Matt Morrow, President of the Springfield Area Chamber of Commerce, and I want to thank you for joining us for our first installment of our 2021 Inside the Issues series. This is a brand new series, and it allows us to take a deeper dive on policy topics and issues that impact our members through conversations with industry-specific experts, and we're very excited today to be introducing this programming this year by covering the pressing topic of vaccinating our region's workforce against COVID-19. Couldn't be more timely, and we are at a key moment in this process, and so we're excited to have our guests with us today, who I will introduce to you in just a moment. But before we begin our program, I want to take just a moment to thank our sponsor for today's event, Berry Tractor. We would not be able to offer this type of timely and relevant programming without the help of our members and the support of Berry Tractor and others who chip in to support that as well. So we want to thank you for your engagement and for your support. Well, over the past year, our members have faced tremendous challenges, obviously, stemming from COVID-19 pandemic and from the efforts to contain it. Our community has remained vigilant in our response and recovery efforts, and the upcoming widespread availability of several COVID-19 vaccines is really just one more tool in our toolbox to move out of this pandemic season stronger than ever. And over the past few months, we've heard from businesses, we've heard from large and small businesses across our region, spanning a wide range of industries and sectors of the economy as they consider COVID-19 vaccination options for their workforce. Very concerned about the health of the workforce and very concerned about certainly getting us to a place where as a community we can move to a greater state of normal. We also know that this topic has created some confusion at all levels, federal level, state, and local, as information has continued to rapidly develop, to pile up, and to change along the way, making it harder to find simple, clear answers to the ever-growing and relevant, timely list of questions. So our hope over the next hour is to give you a chance to hear from three experts to address hesitancy concerns that exist in the population, to provide more specifics on vaccine options for employers, and to give you a chance to ask your most pressing questions as well. We've received some questions already, but if you have any that come up during the course of today's presentation, I'd like to ask you to please email those to Alex Grivey on our team. Her email address is alex, A-L-E-X, @springfieldchamber.com. And we'll do our very best to get to all of those questions in the time that we have today. And if there are any that we don't have time to cover in the next hour, we'll work to make sure that we find answers and follow up with you personally to get those answers to you as well. So please do use that email address, Alex, A-L-E-X, @springfieldchamber.com. We have three great guests with us today. Our first is Shad Berner. He is a regional manager with the Missouri Department of Economic Development. And Shad spent the first part of his career in the Southeast Missouri region, but has been serving the state with a focus on pandemic response and economic recovery for businesses throughout the COVID-19 pandemic. And our next guest is Dr. Nancy Yoon, and she is the Chief Medical Officer at the Springfield-Greene County Health Department. She's been providing education and clinical guidance for community members and partners throughout the COVID-19 pandemic. And finally, Aaron Shikora is a public health information specialist at the Springfield-Greene County Health Department, and he leads the COVID-19 outreach team, and specifically their work connecting our community's workplaces, organizations, and individuals with COVID-19 resources, information, and of course, more recently, vaccinations. We're grateful to have all three of these panelists with us this afternoon. Thank you all very much for being with us today. And so let's go ahead and get started. Shad, let's start with you if we could. I understand you have some slides that you can share with us to give us a sense, a little bit of an overview of how things look from a statewide level. So let's go ahead and move to you first if we could. Welcome, Shad.
Yes, sir. Thank you, Matt. Appreciate you having me. Can I get confirmation that you're seeing my slides?
I see them.
Oh, fantastic. Well, thank you to the Springfield Chamber for allowing me to be a part of this event. I started my career at a Chamber of Commerce, so this is near and dear to my heart. And first thing I want to say before we jump in is you might be wondering why the Department of Economic Development is here talking to you about this today. And really it goes back to Governor Parson approaching the pandemic as in a full whole government approach. So he asked our department to join and help where we could. And Director Dixon and I have been very involved in the vaccine rollout specifically since the early stages. So today, what I wanted to do is just kind of talk through that briefly. I'll talk a little bit about where we are, a little bit about what's ahead, and then specifically about how businesses can get vaccinated. So we'll dive right in. and get going. First of all, as many of you know, the challenge that we had all along with vaccine was a supply and demand challenge. We had way more people wanting the vaccine than we had supply to give. So we had to prioritize. And in Missouri, of course, the first thing we prioritized was saving lives. But then as we went down from there, this is how some of the other phasing and tiers came to be, was trying to understand how best to get the vaccine out to save lives and then keep the economy functioning. To date, this is where we are with vaccines that have been distributed. So if you look on the left side of the screen moving across, the number, the 1.3 million are the number of people who have initiated vaccines in the state of Missouri. That's quite a few, and we'll go through what that specifically means in a little bit when we look at the population numbers. The other thing to kind of note here is that we're going to talk a little about hesitancy today. And we have some early numbers on this, so we don't expect everyone to get the vaccine. We would love if everyone got the vaccine, but we've utilized those hesitancy numbers to inform our thinking along the way, and you'll see some of that throughout the presentation. But to date, we're just over 20%. These numbers were pulled yesterday morning, I believe, but just over 20% of the state's population that have actually initiated the vaccine. This is a breakdown of the actual rollout of phases that we created. So early, we started the vaccine rolling out in late December, and that was with the phase 1A healthcare group. And then we jumped over to 1B in mid-January with the tier 1 and tier 2, and have stayed there most of the time. And you'll see the numbers in here in a second, why we've been in that phase for a while. The rest of phase 1B, tier 3 just opened up recently, and then now we're moving quickly into phase 2 and then opening up to the full population. This breakdown shows specifically what we projected as the number of people eligible in those populations. And the first thing that the astute ones of you on this call are probably looking at is that there are I'm showing 5 million people in the state. Obviously, there's 6.2 million people in the state. The reason there's 5 million is that the total eligible population doesn't include anyone 18 and under 18. So everybody 18 plus is eligible. So that's where you see a delta between the state's population and the eligible population. Now, as I mentioned earlier, that vaccine hesitancy rate, we did some early research in partnership with the Missouri Hospital Association that indicated that about 40% of Missourians would not get the vaccine. And that's a pretty big number. So we've been incorporating that as we look at these populations as we've moved through the tiers and phases. So for instance, just to kind of drive it home here, on the critical infrastructure phase, we have 550,000 people who've fallen into that category. So when we look at that, we think really there's about 330,000 who actually get the vaccine, and that informed our timeline of this. The other thing to note is that these numbers actually are fairly sophisticated, and they pull out, for instance, if you're working at a tier 3 employer, but for maybe you were eligible within tier 3 or tier 2 because you had some sort of health condition that allowed you to be eligible, we removed that person from that count. So this is a fairly accurate count of the numbers across the state of Missouri. And then you can see the timeline here. We activated tier 3 on March 15th. We're activating phase 2 on Monday next week, and then we will quickly move to have the full unvaccinated population eligible. So let's dive a little bit into what those tiers and phases are. The first thing to know is that we defined all of our sectors using the U.S. Cybersecurity and Infrastructure Security Agency. So once the state has the ability to prioritize sectors however they wanted, but then we chose to define who was in that sector with the federal guidelines that are out there. Another thing to note on this is that the plan, we did not distinguish between essential and non-essential employees. And I think that's a really important thing to note. we did not want to put you as an employer in a position where you were having to segment your workforce and choose who got the vaccine and who didn't. So essentially what we said from the beginning was, if your company is eligible for the vaccine because you're a part of tier 3, everybody who works for you is eligible for the vaccine, and you don't have to ask which one of those folks get it. So within tier 3, this is the one that became available on March 15th. This was really our critical infrastructure phase. So when we got into this, we're looking at K through 12 education. We're looking at the energy sector, the folks who work at our utility partners, the food manufacturers, grocery stores, things that were essential to just keep the basic functions of society running. And that's how we kind of define that. This is all on the website, of course. And if you look, anything that has this blue underline, that clicks through to that CISA definition where you can actually see who is included in those sectors. Phase 2, which becomes active on Monday, really opens and broadens the scope of employers that are eligible. So these are critical manufacturers. This opens up the rest of the food sector. So you have restaurants in that sector as well, higher education. We also have in this group disproportionately affected individuals, homeless population. So really a much broader set of Missourians become eligible at this phase. It's not all employers, and that's a distinction that may be important, but certainly a much wider set of employers. As we made our way through these different phases, what we started to understand would happen is when you start to open phases based on population at the beginning, it's fairly easy to look at, well, this part of the state has X% of the population, so we need to give them X vaccine. Well, as you roll new phases open, and it's not just population, it's employers, that's not necessarily based on population anymore, because one area might have more employers than another area. So what you see on the top chart on this side is when we open phase 2, and we did this for all the phases, but I just have phase 2 here. This shows the number of additional eligible population that was added. So for instance, these are all in the metro areas, right? So St. Louis added 252,000. We have Greene County here, added 50,000 people Monday when phase 2 becomes open. What we also look at, just for reference, is a better understanding of what that means as a percent of the overall population of that county. So you can see here that Greene falls off down here, but we have places like Pemiscot. You guys may not know on the southwest corner, but Pemiscot's a very small county. One of these down here at the bottom of the Boot Hill, small, rural, poor county. But this is a huge impact for them because they have a large employer base that's becoming eligible, or a disproportionately affected, whatever it is driving it. So that's good for us to know as we talk to the vaccinators and think about how we're getting that vaccine out to those folks. So let's look now, this is where we start to really drive into what our distribution channels are, how we're distributing that vaccine, and then ultimately how you guys can get it. So as I mentioned earlier, part of that allocation shift, and I'm skipping to the second bullet point here, we started with total population, and then we have now shifted to reflect the unvaccinated eligible population. And we did that for not only the fact that it makes sense to focus on unvaccinated when you're figuring out how much vaccine to give someone, but also because of those businesses that are becoming eligible. The other thing we did, if I step back up a little bit, is we looked at the vaccine deserts. These were defined a couple different ways throughout the process. Initially, we looked at places where there were no vaccinators located, and we made a concerted effort to ensure that we had vaccinators enrolling in all areas of the state to be able to reach the full population. I think we have over 1,000 vaccinators now, so this is no longer an issue. What we are looking at now is not so much deserts, but specifically gaps, I guess you would say. So based on how many people are eligible, how many have it compared to other regions, and we're using any of our extra vaccine on an ongoing basis to kind of plug those gaps and ensure that we stay as equitable as possible. It's hard, it's very difficult to keep it exactly even, but I've been impressed with how close they've been on our distribution throughout the process. So this is a quick look. I have to move something on my screen so I can see the full slide here. But this is a quick look at the total, our various distribution channels, how we allocated, and then last week, this was the actual number we allocated to those channels. So you can see that top one is the high throughput healthcare systems. These are large hospitals, and we have a large hospital system in every region of the state, and I'll share exactly what those regions are in a minute, that are getting vaccine on an ongoing basis. Early on in the process, so for reference, the way the vaccine flows is we get a notification from the federal government on, I think, Tuesday about what vaccine we're getting the next week. We have a couple days to determine where it's going, and then we notify those folks where it's going, and that may take up until Friday or Saturday, and then they get their vaccine the following Tuesday. So there's a very small window for vaccinators to plan. And when I say they get it, we don't even touch the vaccine in the middle. So once we have determined that Cox Hospital is getting vaccine, they get it just shipped directly from the government to their location. So we don't touch it as a state in the middle of that process. But what we needed to do, what became evident really early, was that we needed to provide some more certainty around how much vaccine was coming and when. So that's where the high throughput healthcare systems came in. These hospital systems could deliver at least 5,000 doses every week, and so we were guaranteeing them a share of their doses. You can see here that this was our biggest group. We provided 47% this last week of our allocation to those healthcare systems. And then within that 47%, we were dividing based on the regional approach that we'll look at in a second. You can see the other channels are the mass vax events, which have happened throughout the state and are shifting a little bit now. We also have the Fqhcs, which are the federally qualified health centers. This helps us reach hard to reach populations, very much more so than some of the other groups here. I'll jump down. We have LPHAs and pharmacies, which are both receiving about 13% of the vaccine. And then we have the other community providers. And the reason I jumped down is because this is where, if you're a business and you're not partnered with any of these folks, but you have a third-party vaccinator, this is the bucket that vaccine comes out of. So we're not working with a ton, but it's because we don't have a ton of requests in that space. Most of our businesses are choosing to partner with the other traditional vaccinator channels. And specifically, as the allocation goes up, which we're looking at about 120 or 140,000 here, as that allocation goes up, which is going to start next week, we're expecting more than 200,000 doses next week. We will be providing more doses to the LPHAs, pharmacies, to these folks down here that aren't getting as many doses as the high throughput healthcare centers. So you will see those percentages start to look a little closer moving forward. Move this back now. Okay. The other thing that we really look at is the regional distribution, and I've alluded to this a few times. So on the left, you see the map of Missouri, and there's 9 regions. These are the highway patrol regions within the state. So when we're looking at, for instance, Region D, which is where you guys are, that's 14% of the unvaccinated population. And so we allocate through those channels 14% of our total vaccine, and then we break it down based on the percent that each channel should get within that region. And so that's helped over time provide some clarity. This also, the allocation is starting to look a little different. So for instance, I know offhand that Region C, which is the St. Louis area, has 37% of the state's population. Well, they have 42% of the unvaccinated population as of Monday when phase 2 opens. So you can see how the shift is actually changing the amount of vaccine going to those areas. And it was 140,000 that we were working with last week. So let's talk quickly about how businesses are actually getting those vaccines. We really see 3 ways that this is happening, and I'll jump down so we can just dive into each one individually. The first one is that employees can just go on their own. You can let employees know that they're eligible, and they can go out, they can find a vaccinator, they can sign up on our website through the Missouri Vaccine Navigator, and they can go get vaccinated. That is probably the way most businesses are doing it. And I think that will work in a lot of scenarios, and certainly if that's a way you want to go, I would encourage you to go that route if that's what you want. We also have businesses that are choosing to coordinate with one of those distribution channels I already talked about. So for instance, they may be doing a partnership with, say, Walgreens or a local pharmacy or their local public health agency to do a vaccination, and that could be on-site, or that could be at the vaccinator itself, depending on what that agreement looks like. In that scenario, the vaccinator distribution channel, the pharmacy, the LPHA, they're responsible for requesting the vaccine. They will do it through the state. They'll get it at their channel. They will bring it, either bring it to you or let you know, and you can go in and send your employees in when it's ready. There are a variety of ways you can do that, and it's really in the hands of the locals to make those decisions of what that relationship looks like and what the best path forward is. Then there are the last way, and this is frankly not used as much, but you can either establish a relationship with a third-party vaccinator, which we have several that I've talked to throughout the state, larger companies that are doing this and bringing those vaccines on site. Or in some really rare cases, you may have the medical staff on site, and you may select to sign up as a vaccinator yourself. So we do have, I know of one company, a really large company, that has chosen to go that route. And in that route where you're your own vaccinator, you're responsible for ordering your own vaccine. You're responsible for storing it, administering it, reporting it. If that's not something that you've done in the past, it's probably not the route for you because it's a pretty cumbersome thing to do, and you'd be much better off with the traditional partnership. In the third-party scenario, those folks would be your the ones who order the vaccine, who administer it, who log it and document all this stuff. And then finally, as you kind of look forward, there's just a few different things that I'll share here. Different regions are at different stages. I think everyone here is probably in that Springfield area region, I would assume, and that region seems to be progressing pretty quickly. So I don't think there's any concern there. They're starting to they jumped in with tier 3 pretty quick, is my understanding, and I believe that phase 2 will move right along. So I think everything's operating pretty well there, but certainly would just ask that you have that conversation with your local vaccinators to understand where they are. They may ask, it may be a few weeks before you can get vaccinated, or it may be right away, but it's up to those locals based on their supply, their existing lists, when they can make that happen. The other thing I really wanted to note on this page, I won't read everything, but the surveying your staff is really important. We've mentioned that as few as 40% may actually go seek vaccination, and frankly, that's just not enough. So we really want, it's important, one, for you to understand how many vaccines you actually need, and then two, to help encourage your folks to go get vaccinated. And then finally, of course, we have the Most Outs COVID website, and you can certainly jump on there and find any of the information I just shared. So I know I'm pushing my time, so I'll wrap up there and turn it over.
Thanks so much, Chad. Very, very helpful presentation, a great framework for us to have as we follow the rest of this conversation. I have some questions for you, but I'm going to do what everybody else is being asked to do, which is to wait just a moment on those questions. But if you have questions for Chad, again, I want to remind you that if you have questions for Chad or you have them for any of our other speakers, please email those to Alex Grivey at Alex, A-L-E-X, at springfieldchamber.com, and we will answer all those questions together at the end. So I'm holding mine too, okay? We're gonna move next to Dr. Yoon and to Aaron for local perspective on the COVID-19 vaccine clinical information and rollout. I want to thank you both for being with us today too. So helpful to have your perspective, and so I'll hand it over to you, Dr. Yoon and Aaron.
Okay, let me see if I can share this. Okay, are you seeing that okay?
Yes.
Okay, all right. Well, thank you so much for allowing us to come and join your webinar today. We're very excited to be able to offer the vaccine to larger and larger groups in our community. And we just want everyone to know that we're here as a resource. This is very exciting because all throughout the pandemic, it's been about, what you can't do, don't go here, don't go there, don't do this, don't, stay within 6 feet. But finally, we have a positive tool of something where we can get back to some sense of normalcy. And we all want to get back to our lives. We want to be able to work, see our family and friends, and just do things that we kind of took for granted before. But we know that people may have questions or, would like more information about the vaccine, and that's normal. And that's what we're here to try to help provide today. So this is just a brief outline of my talk. I'll be going over kind of some of the clinical and medical aspects. And some of my slides are a little bit technical, and I won't go too in depth, but if there are any questions about them, definitely let us know today, or also in follow-up, we can get back to you with more information. Okay. So this is just a brief. I took this from yesterday from the CDC website, just looking at the numbers of people who have been vaccinated in the United States. In total, over 85 million have received at least one dose, and over 46 million are fully vaccinated with 2 doses. So we're getting there. It's slow, but we are making progress every day. So there are many reasons to get vaccinated. Again, as I mentioned, it's just another powerful tool that we have to help stop the pandemic. It will protect you from getting COVID-19, and I'll talk a little bit more about exactly how the vaccines work, but in general, it creates an immune response where your body is forming antibodies to help protect you from if you do get exposed to the virus. And this will protect not only you, but your family, coworkers, anyone that you interact with on a regular basis. And it is a safer way to build protection. Some people wonder, well, can I just get COVID-19, get the infection and then get protection from that? That does provide some protection, but we don't know exactly how long that lasts. And studies have shown that the level of immunity that you get from the vaccine typically will last longer than just getting the natural infection. And it is safer because some people, as we know, have to be hospitalized, there have been deaths, and there can also be long-term symptoms that linger on for several months after the infection. So this picture just kind of depicts what you may have heard of as herd immunity. So on the top row, the people in purple are not immunized, and then those people in the red are the ones that become infected. And so as you can see on the right side, basically, it just spreads very quickly throughout and almost everyone gets infected. On the bottom, the yellow people are the ones that are starting to get immunized. And kind of as you move to the bottom, as there are more yellow people who are protected from immunization, it's a lot harder for the virus to spread. So there are a lot less of the people who become sick, the people in red. So you can kind of see the progression. So that's kind of the concept of herd immunity. The more people that are protected, the less the virus will spread. So we currently have 3 vaccines that are approved in the United States. Pfizer and Moderna were the first 2, and these are both mRNA vaccines, and they're both 2-dose series. And then most recently is the Johnson & Johnson, which is a 1-dose. This just shows the mRNA vaccines require either the 2 doses spread 21 or 28 days apart, and it's very important that everyone gets both doses. And you're considered fully immunized 2 weeks after your 2nd dose. So not immediately, but you need to wait that 2 weeks. For the Johnson & Johnson, it is 1 dose, and you're fully immunized 2 weeks after you get that dose. So just briefly, what an mRNA vaccine is, it's actually the genetic material of the spike protein, and that's part of the SARS-CoV-2 virus. When the body sees those instructions, it knows how to form antibodies against it, and then it'll kind of form a memory. So it stores up those antibodies. If you go out and you get exposed to the virus, your body knows how to combat that with the antibodies. A few notes about that. mRNA does not interact or affect our DNA, and it cannot give you COVID-19. And these vaccines are a new type of vaccine, but the technology that went into it has been studied for many decades. It's been studied for various other diseases such as flu, Zika, rabies, CMV, and different types of cancers. So they were able to build upon knowledge and research that they already knew about. So the viral vaccines, which is the Johnson & Johnson, it's slightly different, but also similar because it just, again, carries that genetic information using a viral vector. And so the similar process, the body gets those instructions and learns how to form those protective antibodies. And again, there's no interaction with our DNA. And these types of vaccines have been used for other diseases as well. So again, they will not give you the COVID-19 infection because there's no live virus. Okay. So safety is a big question that we get a lot, and there has been rigorous safety studies throughout the clinical trials as well as the experience, now that we have over 80 million people in this country and even more worldwide who have been immunized. There are several independent safety monitoring boards, and this is all publicly available information. There's been the FDA and CDC and multiple different groups studying all of this data. So large numbers and overall very few serious adverse reactions. We'll talk a little bit more about side effects, but overall the safety is considered very good. This slide just shows kind of the traditional vaccine approval process. People wonder, well, how did we get these so quickly in less than a year? It's because many of these steps were done simultaneously. So in traditional vaccine research, they're done in a sequential step, and there's some time in between each phase. But based on the amount of funding that was put into it and also just the worldwide collaboration among scientists, they were able to do these more simultaneously, and there was also production going on even before they were fully authorized and released to the public. So those are some of the several reasons why we were able to get these vaccines relatively quickly. But there was still the same, safety review, FDA review, and none of those corners were cut for safety. So just to give you a little bit of efficacy data as far as how well they work, they are highly effective, about 95% with the Pfizer. They've studied this across ages and different medical conditions, and so the efficacy is very high. This is similar with the Mrna vaccine. This slide goes over the J&J, and it's broken down a little bit more because the trials were done in the United States as well as in Central America and South Africa. In addition, these studies were done a little bit later than the Pfizer and Mrna. So because they were later, some of these viral variants were already circulating, and so that's why you'll see some of the numbers are slightly lower than the Pfizer and Mrna. But if you look at the overall efficacy against the most severe, so cases where you'll be hospitalized or have death, it was 85% effective, and that's still very high. That's still considered, an excellent level to protect the majority of the population. And this slide goes a little bit breaking down into some of the variants. So all of the vaccines are being studied against the variants. So again, because with the initial Pfizer and Mrna, the variants were not as prevalent, but now they are. But they're still, looking at the Johnson & Johnson, 74% against variants. And so that's still at a level where it's still considered worthwhile to keep giving it. But they're continuing to study this, and if they need to adjust the vaccines or possibly give booster doses, they'll be ready to do that if it doesn't seem like the efficacy is high enough. And then these are some reasons why a person should not get the vaccine, and it's not very common, but in people who have had some sort of severe allergic reaction, this would be anaphylaxis where they're cannot breathe, very, could be a life-threatening condition, then those people should not get it, such as if they have a reaction to their first dose. And this would typically happen within 15 to 30 minutes, so that's why we build in that monitoring period. And in people who have allergies to other, foods or kind of some other immunizations in the past, if it's more like a prolonged kind of like, oh, I didn't feel well for a couple of days, that's not the immediate reaction that we're talking about. So most people, even if they're allergic to other substances, besides anything that is within the vaccine, they are probably safe to get it, but we would monitor them for more like the 30-minute time period. So again, but if people have questions or they, multiple allergies, it's not a bad idea to talk this over with your doctor or if you have an allergist, just to make sure that it is safe. And all of the facilities do have an anaphylaxis protocol, so they have equipment, they're able to give epinephrine if people need it, basically just call 911, and they'll be able to stabilize people. But again, it is a pretty rare occurrence. About 3 or 4 per million doses given is how often we're seeing it happen. And the more common side effects would be things like pain at the injection site, having headache, body aches, muscle pains, fatigue. But this is actually a good sign. It means, the vaccine is working, your body is developing an immune response. So it's really, just recruiting everything to form those protective antibodies. But we understand people may be very uncomfortable, may even need to take a day off work or something. So just to be aware and to plan for that. And again, these will typically last just 1 or 2 days. Some people have mentioned that it's worse with a second dose, but not everybody. So it's just very individual, but it is good to kind of be aware ahead of time what symptoms you might have. And again, safety is a top priority. There's ongoing safety review. And so as they learn more, if there are any serious safety concerns, we'll be aware of that. And we're, again, like everything with the virus, we're continuing to learn every day. And so sometimes if changes need to be made or new recommendations, they'll be ready to do that. And there are multiple safety monitoring systems. There's an app on your phone called vSafe that you can download that will ask you about any symptoms that you have. And if there are any, concerning, things that come up, there will be follow up with each individual person. But there are, benefits to getting vaccinated. People who are fully vaccinated, again, which is 2 weeks after your last dose, can visit with other fully vaccinated people without needing to wear masks or, doing any of the physical distancing. So that's really a great thing. The CDC has also said that fully vaccinated people can visit with unvaccinated people from a single household. So an example of this would be like grandparents who are vaccinated can go see their grandkids who are not vaccinated and considered to be a safe activity. And also if a vaccinated person is exposed to a COVID patient, then they do not have to quarantine, whereas in the past it was recommended to quarantine. So, but again, if you're in a setting with large crowds and because you may not know how many people are vaccinated, it is still recommended to wear the mask and do the distancing and all of those precautions. But there are benefits if you are vaccinated. Okay, and then just a few more clinical notes. Even if you've had COVID-19, again, we do recommend everyone get vaccinated because we believe it provides fuller protection. And again, with the variants, not knowing how prevalent that will be, even if you've had it, it is possible to get the infection again. Pregnant women, we are collecting more information about it, the safety of the vaccine. We do know that pregnant women, if they get the COVID-19 infection, that can be pretty harmful to their pregnancy or their baby. So to prevent that, we do generally recommend that pregnant women do get the vaccine. As well as if you're breastfeeding, there's been no safety concerns or reports that there's problems with breastfeeding. And actually, there's been evidence that babies born to mothers who had the vaccine during their pregnancy have the antibodies. So it does protect the babies as well. So these are just some overall things that you can do. We do encourage people to get vaccinated because it protects you, it protects your coworkers and friends and your community. And you can participate in the VSafe to report any side effects. It's great if you share your experience with the coworkers, say it wasn't a scary thing, I was fine, I may have had side effects for a couple days, but I got over it and, now I'm protected. And, if you feel comfortable sharing information from good reputable sources, some people post pictures of themselves getting the vaccine, but anything to promote the vaccine, saying that it's not a scary thing, it's a good thing, will help the people around you also get vaccinated. So that's all of my slides, and then these are, I'm going to turn it over to Aaron now.
Thanks so much, Dr. Yoon, and we'll have Aaron take it next up. And as he's doing that, I think, Aaron, are you doing your own slides, or is Dr. Yoon doing yours? You're set to go?
I am set to go.
Okay. All right, take it from here.
All right, good afternoon, everyone. So I'm Aaron Shakora. So I'm going to talk about a few of the ways that you can access the vaccine. So Shad mentioned that there were 3 different ways. It's either you're going to the vaccine through an on-site or an off-site clinic, or with a vaccination partner, or as an employer, you're trying to access an on-site opportunity for your employees, potentially even in the workplace. And those are the 2 that I'm going to kind of talk about what that looks like here in Springfield and Greene County. So the first option, as we mentioned, it's individual initiated. So that is when your staff are going online or giving us a call, or working with another vaccinator here in our community to create their own appointment. They found an event, they know where they're going to go, where they want to get the vaccine, and all of that information. It could also look like we're sharing that information with you, and you're sharing it with your employees who are motivated to go and get that vaccination. So this option works really great for our smaller workplaces, or workplaces that are kind of spread out, that have a lot of staff in a variety of different locations and don't have that one large location with many staff members who are still needing their COVID-19 vaccination. But also this option does work for anybody who is eager to get the vaccine, since they can make their own appointment and get themselves there and get that vaccine. So the best way to go about this is to identify an event or a vaccinator that's going to work best. You can do that by looking at both our opportunities as well as the other opportunities in our county by going to health.springfieldmo.gov/vaccine registration. The Chamber's Vaccine Resource Center also has all of this information as well. So we would ask that you make these options available to your staff and let them know how to register and sign up. To make it a little bit simpler, what we do for our vaccination events, as well as the partner that we're working the closest with, Jordan Valley Community Health Center, is we send out those opportunities in a weekly business update to everybody that is on our business list. And you can subscribe to that email list here at this link here. And that's a SurveyMonkey, just because it's easy. So surveymonkey.com/r/vaccine essential. Getting on that list will also allow us to figure out if you're interested in on-site opportunities as well, or would just generally like more information about the COVID-19 vaccine. So a couple of things to note is that most of these vaccination events are going to be held during normal business hours. So if you're an 8 to 5 Monday through Friday business, you will need to consider what your staffing needs are during this time if you are going to make these events available to your staff. So maybe that might look like sending people over in waves one day, a few early in the morning, a few around lunchtime, and a few at the end of the day, just to kind of stagger that and make sure that you have good coverage in your office. We are to a point where we are having multiple vaccination events a week over there at the Jordan Valley Springfield-Greene County vaccination site. So you could also break it up over multiple days. If you have multiple shifts, of course, then if you have people that don't work during those times, obviously these are going to be a great option for them because they're not going to have to go over during their normal business day. However, we do encourage you to make this an option for your staff because it will help make sure that they are able to carve the time out of their day to get their COVID-19 vaccine. And we do have slots available next week. So as it was mentioned, phase 2 does start on Monday. There are opportunities Monday, Tuesday, and Wednesday here in Springfield and Greene County to get the COVID-19 vaccine through this method. So when you go to our website, this is basically the breakdown We have it set up as a ready, set, go. So the ready is going to be to get registered on Missouri's Vaccine Navigator and get your patient ID. And then the set is actually going to be to schedule. So when you go to this part of our website, these are actually buttons that you'll click. You'll click this, get your patient ID, and get registered. Getting registered on Missouri's Vaccine Navigator really helps us the day of during the clinic with a very streamlined process, which means that the hour that we've had folks allocate for their appointment really looks like 30 minutes because most of the screening, all that information collection, and all of that is done already ahead of time. And then we can get them in, get them vaccinated, get them over to their 15-minute observation, and get them back, get them out and on with the rest of their day. So SET is going to be making that actual appointment, and this link right here to schedule your appointment over there on the vaccine registration page is going to take you to both Jordan Valley and Springfield-Greene County Health Department opportunities for the rest of this month and even into April. So just make sure that if you are a phase 2 eligible individual, you're signing up for those opportunities on March 29th and after. And then obviously go to that vaccination event. All you need to bring with you is your patient ID, the number that you're going to get when you finish signing up for Vaccine Navigator, and make sure that you are arriving at the appropriate location at the right time. All right, and so this is going to be the information that I feel like most people are interested in, seeing that we are kind of focusing on our business community and our employers. So what can you do? What's the employer's role in this model? And that's going to be to share that information with your employers that we're sending out on a weekly basis to make sure that anybody who is ready and able to get the COVID-19 vaccine has all of the resources and tools that they need to do so. So like I mentioned, allowing staff to schedule those appointments during their shift if you are an 8 to 5 Monday through Friday business, and then making vaccine education resources available to the entire workplace. In addition to scheduling information, we are going to be sending out valuable information and a lot of vaccine education resources to that list as well. And those are tools that you can share with your employees for those basic questions and to really just kind of understand what the vaccine is and how it works. And then if they have additional questions, they can direct those questions to our call center, and that phone number is 874-1211, or email them to coronavirus@springfieldmo.gov. Sometimes if they have a question for the call center, they may have them email that to us, so that way we can get Dr. Yoon's expert opinion on that if it's not something that we've answered before. So and this is the model that we're really trying to focus on here with phase 1B tier 3 and phase 2, and get that information out there so we can get more employees vaccinated. So this is going to be an employee initiated. We're going to bring the vaccine to you. And so in this model, the employer is going to reach out to us, and we already have a list of over 400 that have reached out to us and expressed interest in getting on our list, and many of those are wanting the vaccine in their workplace. And so what that looks like is this is a great option for workplaces that have a lot more staff that are needing the vaccine, and it's the best option for workplaces that have employed or contract healthcare staff that can serve as vaccinators, because that really helps free up some of our vaccinators to continue serving the community at our mass vaccination sites. However, if you do not have those healthcare staff, still reach out to us, and as soon as we have that opportunity available, or if there's an opportunity to connect you with another vaccine partner, we definitely want to ensure that we are making it as convenient as possible for your staff. We've seen that increasing that convenience is really going to reduce complacency. So if you have staff that are fine with getting the vaccine, or say they're going to get it but haven't actually taken that step to make that appointment, having it in the workplace is going to make it extremely convenient for them. And we've seen that the more convenient it is, the more people get the vaccine. So we want to make it as accessible as possible to as many people as possible. So interested workplaces who are not already on our business list can get on that list at the link that I referenced earlier, that's surveymonkey.com/r/vaccine-essential, or can let us know by emailing us at coronavirus@springfieldmo.gov, or calling the outreach team at 417-874-2777. There are also opportunities, as I mentioned, with other vaccine partners. So when in doubt, reach out to us and we'll connect you with the best opportunity, the opportunity that makes the most sense for you. We have vaccination partners who are already vaccinating in workplaces, and we have some that are reaching out to us trying to get your information so that way we can get you connected to them and they can get your employees vaccinated. And like I mentioned, even if you just reach out to us here at this email, you still want to get signed up on that vaccine essential list, so that way we can send you those educational materials, reach out with other outreach and education opportunities, and just make sure you have the best and most up-to-date information. And so like I mentioned, and like was mentioned earlier, surveying your employees is going to be a crucial first step in this process. The Chamber has an employee count form up on their Vaccine Resource Center that makes this very easy. You just provide it to all your employees, and they're going to fill that form out, get it back to you. And you'll get a great count on how many people in your workplace are ready to get the COVID-19 vaccine. And possibly more importantly, how many aren't. And if you do find that you have a lot of individuals who are not ready to get the vaccine and are not currently planning on it, let us know and we can set up something where we can work with you to provide those educational resources, answer those questions, even potentially do a presentation in your workplace, of course, over the internet, and really get your staff the information they need to get them from not yet to I'm ready to get the vaccine. So one thing to note with this is we will ask that you schedule and coordinate all of those appointments for your staff and make sure that during the allotted time for that clinic, we can get people in and out as efficiently as possible, and recognize that if you are those clinics are being done with Pfizer and Moderna, you will have to do that again in between 21 and 28 days later for that second dose. So just reach out to us if you have any questions, and reach out to us if you need those vaccine education resources, and let us know if you have anything else that you need or any other questions. But that's all I have. We can take some questions.
Aaron, thanks so much. And thank you, Dr. Yoon, as well. So good to be able to have that information from trusted local source that we have come to rely on very heavily during this time. So I know that our members will have some questions for all three panelists. So let's go ahead and move to those as quickly as we can. I know we want to be efficient with our time. So if you have a quick answer on these, please go ahead and just bring that and we'll move to the next question. We have one from one of our members who is asking, this is probably for you, Dr. Yoon, if someone has had COVID, is there a period of time they should wait before getting vaccinated, or is that a factor?
It's just recommended that people are not in their isolation period. So if you have COVID, you need to be isolated for at least 10 days. As well, if you've received some sort of specialized therapies like a monoclonal antibody or convalescent plasma as treatment for COVID, you need to wait 90 days. But apart from that, if you've had COVID, maybe a couple months ago, and you're feeling fine, then it's fine to go ahead and get the vaccine. There's no actual time period that you need to wait.
Okay, thanks very much. Shad, I'd like to come to you with our next question, and this is for employers who will become eligible next Monday, the 29th, or maybe even those who are eligible now but haven't yet pursued vaccination opportunities. I think I heard you reference, but I want to make sure this is very clear. Employees do not have to have any proof of employment at their employer in order to make that employee eligible to receive a vaccine appointment. Is that true, or is there anything they need to produce to say that I work for this company and I'm here for a vaccine?
Yeah, that's correct. So we chose to be a self-attestation state. So they will sign a form, and the one on Vaccine Navigator that Aaron was referring to will ask them to select their phase, and then they will attest that they're in that phase, and that's all they need to do.
Okay, quick follow-up on that while I've got you here. We've had questions from several businesses related to what phase they are in. And I mean, you guys speak this like it's a native language, but for a lot of us, the phase 3, 2B, 1, or whatever it is, it's kind of complicated. So is that phase, is that once phase 2 is activated on March 29, most businesses, if I understand correctly, will be eligible to get vaccinated. But could you talk a little bit about the main differences between the businesses that are currently eligible and the ones that are about to become eligible in the next couple of phases as those are activated?
Sure. Yeah. So what we did was the tier 3 was what we considered critical infrastructure. So these are things that keep society functioning from an actual moving around standpoint and just the daily activities that need to take place. Phase 2 was what we considered critical manufacturing. And so the things behind all that that's necessary to make that function was kind of the next step. So it's not necessarily all businesses coming eligible on when phase 2 opens, but a lot. And then also certainly the local folks have some authority in this as you kind of move into that next phase and they start to look at it. They do have a little bit of clinical judgment that can be used, and they can make some judgment calls on the local level based on their supply and what's happening, especially considering how close we are to opening everything up.
Okay. Dr. Yoon, can I come back to you for a minute? We know that many employers want to get their workforce vaccinated as quickly as possible in the most efficient way possible, but some are a little concerned about all of their employees being sick at the same time. If they feel bad after one of the shots, maybe unable to return to work the next day. Anything that employers should expect from those receiving the vaccine, and how maybe would you recommend they prepare for some of the potential side effects in the workforce?
Yeah, that's a great question, and just a good, just thinking about planning. But yeah, just to take into account that a certain percentage, maybe up to half of the people might need to take a day or two off of work just from those side effects. So it would be a good idea to not have everyone go the same day, but maybe stagger it at least by a few days. Sometimes if some people could go on a Friday, and if they're off on the weekend, that's a good time to go. Or just basically just having some sort of system where you're staggering it. And hopefully not everyone will need to call off work. A lot of people can still go to work depending on what their job is. But yeah, it is definitely good to plan ahead for that scenario.
Aaron, if an employer wants to host a vaccination clinic, an on-site clinic, what's the first step they should take? What's the first thing they should do?
The first thing they should do is to reach out to the health department and then figure out how many employees they're actually are going to be needing the vaccine. So that's excluding those who are not yet ready to get the vaccine, but also those who have already gotten it as a part of the 65 and plus or high risk population. So figuring that number out will really help us connect them with the best opportunity to bring the vaccine to them.
Is there advice you would have for employers who want to have all of their a large number of their employees vaccinated at about the same time, to evaluate whether the best fit for them is an on-site employer's facility or hosted off-site at one of these partners like Jordan Valley or the Majors Health Clinic at Missouri State? Is there a way that you would advise them to evaluate which is the better option for them?
Well, I think if their staff are very motivated to get the vaccine, and many of them are already seeking those appointments on their own, probably the best thing is going to be just to connect them with those resources. So those that have not sought that information out for themselves can do that. But if they have a large workforce and many of them are unvaccinated and they are really wanting to get their workforce vaccinated quickly and get as close to full vaccination as possible, it definitely doesn't hurt to just go ahead and reach out and see if it's going to be a right fit to do an on-site event, because the more employees they have, the more efficient it is for us to just come out and bring that vaccine to them.
Okay, I will just share for the benefit of those on the call that our partners at Missouri State University have been working on plans and are finalizing, in fact, those plans for additional opportunities for the business community to get their employees vaccinated. And so we haven't even really had a chance to talk about that much today, but we will keep you updated as more information on that becomes available. And so if you have interest as an employer in getting larger groups vaccinated, another option you can do certainly is to reach out to us at the chamber. If we need to direct you to the health department, we'll certainly do that as well. We're working to try to help make those connections with Missouri State University directly for some employers also. So just reach out. Anybody on this call can be a resource to you as an employer who's trying to help get those vaccinations done. Well, we have covered a lot of ground today, and I'm so grateful for our guests being with us, but unfortunately our time is up. So I want to thank all three of our panelists for joining us today and for sharing their insights and perspective, for helping us do a deep dive in what it's going to take for, especially from an employer's perspective, to help vaccinate their workforce and ultimately the population. Very, very grateful for your willingness to help us create more clarity for employers around the topic of vaccinating our region's workforce. State and local partners like the Missouri Department of Economic Development and Springfield-Greene County Health Department have just been incredible partners and significant players in bringing our community and our state through this pandemic. And we're just really, really grateful for your efforts. For those who are attending here on the program, I want to draw your attention one final time to our online resource. It's been mentioned a couple of times today, the Vaccine Resource Center for Employers. That's at springfieldchamber.com/vaccine. We are updating that page daily with timely and relevant updates, news, best practices for employers. These very partners are providing a lot of those resources that go to that as well. So thank you so much for continuing to help make sure that we provide the best information for businesses in our community and our region. And a big thank you again to our event sponsor, Berry Tractor, for their sponsorship and support of the Inside the Issues series. And I want to again thank all of our members who joined us today. We know that this has been a difficult time for our business community, and we're here to continue trying to support you, work to provide those needs that you have as you communicate them to us, and connecting you with timely information and resources. And as always, we're grateful for your membership. I want to thank you all for being a part of the Springfield Area Chamber of Commerce.